everyone. Thanks for tuning into my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. Lots of mixed news this week. The US and world numbers are headed downward, cases, hospitalizations, and deaths. The proportion of new infections that is due to the BA.2 subvariant of Omicron is now estimated at 72% in the US and 84% in New England. That's actually good news because, all things considered, the rise in cases we're seeing in Massachusetts and the increase in wastewater levels are relatively gentle as we approach a complete changeover to BA.2. This is different than what has been seen in many European countries, but there's good news there too. Many of the countries that saw second spikes from BA.2 are on the decline again. Omicron is just so fast and furious. So this week, more than 99% of the US is in an area of low or medium risk, which, as you recall, means masks not broadly recommended. The first question comes from Isabel from Lawrence. There is so much confusion around a fourth COVID booster shot. Who should get it and when? Could you help clear things up? Unfortunately, we are being asked to embrace uncertainty here in a way we really haven't before. The FDA decided to authorize fourth shots for people over 50 based on data from Israel from people over 60, showing that hospitalizations and deaths went from a small number to a smaller number when comparing people with 3 shots to people with 4. Now, Peter Marks from the vaccine division of the FDA said they decided to make the shots available because we know that immunity from vaccines wanes, and we never know what's coming next and how quickly. Getting a fourth dose is not part of the CDC definition of up to date on vaccination, though. It is a personal choice. The older you are and the more underlying medical conditions you have, the more you stand to benefit from getting the fourth shot sooner than later. But you could choose to wait to see if cases really rise later in the year, to see if a new vaccine formulation comes out, or even just to get the shot closer in time to a major trip or event. I have my first international trip of the pandemic planned for the summer, so I think my approach might be to get it right before that. Antibodies will still be high and actually prevent me from getting infection, not just severe disease. Our second question is from Jared from Quincy. Massachusetts has seen an uptick in COVID-19 cases, COVID cases in schools, and wastewater data in the past few weeks. What does it all mean, and when will we know if we have avoided another significant surge? Well, Massachusetts and New York are experiencing very mild upticks in cases. I'm showing a log plot of the case rates because on a regular linear graph, it's really hard to see. The wastewater viral levels are increasing here as well, but not nearly with the rapidity with which they did so in November, December. One of the reasons why the BA.2 subvariant is thought to be more contagious is that it's associated with higher viral loads. Higher viral loads would mean more virus in the wastewater, even in the absence of an increase in cases. And case data are quite inaccurate right now since so much testing is happening at home. But I do think the rise in cases is real. That being said, the current CDC approach is to focus less on cases and more on hospitalizations and hospital capacity, and those continue to improve. Yes, hospitalizations lag cases. We might not see the effect yet, if there will be one. I'm hopeful that what we're seeing in Europe, which is cases falling again in many countries, will soon be what we see in states that have seen an uptick. But hope is not a strategy, and those of us who work in hospitals remain ready to scale up testing and treatment and capacity as needed. We also really need the federal government to be properly funding support for preparedness at a state and national level. And our last question is from Kayla from Dedham. It seems that there is yet another COVID-19 variant with new cases in the UK. I know there have been many variants and subvariants, and so far only a couple have really posed a problem, but should we be concerned about this one? Well, one important clarification. There's no new VOC or variant of concern. Everything out there is Omicron. There are sublineages of Omicron, such as BA2, which is now predominant in the US, and there are strains that are reassortments or combinations of Omicron subvariants or of Omicron and Delta. So you may be talking about the XE strain, which is a hybrid of BA1 and BA2. Now, there are a lot of scary headlines, but remember that if it bleeds, it leads. Headlines are often scarier than reality. Most experts I've checked in with do not think XE is particularly concerning. It's just Omicron after all, and we know Omicron. Vaccines protect against it, the population has lots of immunity, and is less severe than prior variants. In fact, there's a new study published in JAMA last week that showed that despite a lot of scary headlines a month or so ago suggesting otherwise, even children younger than 5 experienced less severe disease from Omicron compared to Delta infection. That's all the time we have for this week. You can send me your questions about Omicron subvariants, the recent uptick in COVID cases, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.